Hello, everyone. My name is Claudia Mora, and I am a nurse practitioner student at Azusa Pacific in my Pediatrics 590 class rotation, and this is an infomercial, okay? We're going to pretend that Jacqueline is 10 and her mother is here, so she's a school age, and then we will get started. Okay, hi, Jacqueline.
Hi.
My name's Claudia Mora. I'm going to be your nurse practitioner student, okay? So, what's the reason for your visit today?
My head is itching a lot.
It's itching a lot. How old are you?
10.
10 years old. Okay. And then mom is in the room throughout my exam. I've already done the hand hygiene. Okay, so how long has it been itching for?
A couple of weeks.
A couple of weeks. Okay.
Yeah.
And then are you sharing your combs with someone?
Yeah.
Yes. With who?
My friends.
With your friends. And are your friends' head itching as well?
Yes.
Okay, so what Jacqueline is describing now, my main diagnosis already, I'm already thinking in my head, will be head lice, okay? So it's tinea capititis, also pediculitis, okay? So it's basically infestation. So Jackie, can I take a look? Okay, so I am searching her scalp. So head lice are little insects that live in the scalp and they feed off of blood, and that's how they remain alive. So, Jackie, the head lice can be confused sometimes as dandruff because it's like white or botchy little yellow particles. But the reason we know it's head lice is because of the lice knit, right? The little eggs they lay. So the little eggs they lay, they're very close to the hair shaft and the scalp. Okay, so I will show you a picture, Jackie, of what the actual insects look like, and they're the ones that lay the eggs. Okay, so just for the camera, these are what the insects look like. Sorry, this is what the insects look like. So they're about 3 millimeters, very, very small little lice looking like insects that live in your scalp, suck up your blood, and that's how they reproduce. So they lay a lot of eggs, hundreds and hundreds of eggs, okay? And they're very contagious. So if your friends have them, they're going to give them to you. So there's this whole stigma about you not being clean, and that's how you get them, which is not always the case. They're very contagious. They cause a lot of itchiness, and they also tend to hide in the dark. So it's very important that when we're doing the exam, they like to come out in the dark, so they hide in the light. So as and they're very very fast little creatures. So you need to get a fine knit comb. So mom, please get a little comb. Put a lot of shampoo and any conditioner, and then she has beautiful long hair. So Jackie, it's going to be more difficult for you to get rid of this infestation. But what we advise is with the comb, mom, you can comb her hair so that you can get all those little eggs that they're, the little nits that create more infestation. And then you can just comb it through, comb it through. It's very, very important also to keep your head clean. Stop sharing things because they're very contagious. So mom needs to change all the sheets and like your clothes because those little bugs jump. Okay, and so if we treat this, we're gonna treat it. I'm gonna prescribe, and it's also over the counter, but I'll write a prescription to see if your medical group covers it. It's called permethrin 1%, also known as Nix, Nix. And that you're gonna shampoo, you're gonna wet your hair. Mom's gonna wet your hair, and we're gonna put it all over your scalp. We want to start from the scalp, and we want to use the comb, okay? And every single fine hair, we want to make sure it's lather and cover really good. You want to leave on for about 20 minutes or 25 minutes. You can look at the camera, Jackie. And you can repeat this as needed, okay? A lot of these treatments are over the counter. Mom, you can use the spray as well until the infestation is treated. The time frame, it could vary from kid to kid, especially when you have a lot of hair and it's longer. It could be 5 to 7 days, but you have to make sure you wash everything, you keep everything clean, She should stop sharing combs with the students. This is very common. This condition is very common around school age because this is when they tend to share, like Jacqueline said, their brush. Again, there's a social stigma, but it can happen to the best of us. Okay, Jackie, do you have any questions? No? And the itchiness that you have, that's normal as they're like sucking on your blood on your scalp. That's what creates the itchiness, okay? And then you're going to have a feeling like something's crawling in there, right? Like, do you feel like the tingling? And that's them just trying to get through your hairs, okay? So very important thing to do is stop sharing the brushes. You're going to use the treatment that we recommended. You're going to keep your hair clean. Hopefully, if this goes away, we avoid of cutting it because sometimes having short hair it's easier to manage. Okay? And then we were gonna hopefully it goes away, and then if it doesn't, you can come back and make an appointment with us, and mom can bring you back. Okay? But it's nothing you did wrong. Again, this is just a head lice infestation that happens around your age group of kids, and it's something that is not life threatening, and a lot of kids experience it. Okay? Do you have any questions? Okay, thank you very much for your time. Have a nice day. So just to recap, we talked about the diagnosis, which is the head lice. The background is unknown. It could have been spread by somebody else that had an infestation. I recommended the treatment, the Nix 1%. I recommended ways of getting rid of the infestation by cleaning, by keeping it clean, using it. The symptoms that she has are common and normal, which is scratching, itchiness, feeling like a sensation like something's crawling in her scalp. And then we can make an appointment in about 2 weeks. If it doesn't get better, there's a lot of sprays over the counter. Mom can get them at Walmart or Target. And basically, the most important thing to treat the head lice is to stop the infestation, stop from spreading it, wash everything like sheets, blankets, clothes that she might have on when the infestation is present because it's very contagious. And also the most important thing will be to just keep an eye on it so it doesn't keep spreading. And that's about it. Anything else? They can let me know. Thank you for your time.